freezer.
Yeah, but how cheap was it that you wanted to buy this much of it?
Honey, this is wonderful cheese. It comes from Switzerland. Very hard to get.
How could it be hard to get? It's all here.
That was Albert Brooks and the now late Debbie Reynolds in the 1996 film Mother. Reynolds died just one day after her daughter, actress Carrie Fisher, died from a cardiac event. Her son, Todd Fisher, told CNN that, quote, she said she missed Carrie. She's with Carrie now. It's a heartbreaking story, perhaps literally heartbreaking. And while we do not know the cause of death for the 84-year-old Hollywood star, this does raise the same question you've read about when you see in the paper about some elderly couple dying just hours apart. Can the cause of death be in any way a broken heart? Let's bring in Dr. Kevin Campbell to lay out some possible explanations. He's a cardiologist, and he joins us now from North Carolina. Dr. Campbell, thanks for joining us. Let's just cut to it. Can someone die from a broken heart? Is that possible?
Well, believe it or not, there is something called broken heart syndrome. It's called Takotsubo's cardiomyopathy, and it's really related to the stress of a life-changing event, like an earthquake or a death of a close relative, and it can mimic the signs and symptoms of a heart attack and really look just like a real-life heart attack.
What happens physically to the body when this incredibly stressful event happens?
Well, first of all, we know that this seems to be related to the release of a lot of hormones in the body, like adrenaline or epinephrine and cortisol. And these things can raise blood pressure, increase heart rate, make blood vessels stiffer, and it can actually make everything for all the world look just like a real heart attack. And in some cases, it can cause real biologic problems.
So when somebody reads about an elderly couple, he's 95, he passes away, and then his 94-year-old wife dies 5 hours later, it's not just fiction. She might have actually died of a broken heart. It's possible.
Absolutely, because when we release all of these stress hormones, they can have negative impacts on our body, especially if you have underlying heart disease, or you may have underlying brain disease in the case of maybe a stroke in Miss Reynolds, that could, precipitate that event. This happens 90% of the time in women who are postmenopausal, this Takotsubo's cardiomyopathy.
So there is a cause of death listed that says, in whatever language, broken heart syndrome?
Well, we don't necessarily list causes of death that way. We may say, cardiac death or something of that sort, or cardiac arrest, but Takotsubo is a syndrome that we see. And when you actually image or take pictures of these hearts, they look just like failing hearts in the midst of a heart attack. The difference is most of these are self-limited and get better within a matter of weeks to days.
How common is it?
90% of the time we see it in women. All populations altogether, it's relatively uncommon. But it's common enough that it was described in 1990, and there's been lots of study about it. We still don't quite fully understand the disease, but we treat it just like a real heart attack until proven otherwise.
Fascinating. Dr. Kevin Campbell, thank you so much. Really appreciate it. Happy New Year to you, sir.
Happy New Year. Thanks for having me.
That's it for me. I'll be back at 4 Eastern on The Lead for our international viewers. Newsroom with Jonathan Mann is next, and for our viewers in the United States, Newsroom with Frederica.